Allow her to defend her logic.
The difference there is there is a federal law. It's called EMTALA. It requires everyone who gets sick and needs emergency care to be able to go to the emergency room. There are no such provisions. There's no such law in other areas. Conservatives don't want to take on the essential rule that the sickest amongst us get coverage when they're sick, when they have an emergency room. They don't want to take on that law, but they want to take on this one. And that law underpins this Affordable Care Act, and why it's important that it's maintained so that we can actually keep things like pre-existing conditions, so people who have cancer, who have other illnesses can actually get the protection of this law. These pieces are interrelated, they're critically important, and they're interconnected. And just on the tax issue, I would say this is an area where the judge clearly overreached. This is part of the IRS code. He chose to determine that it is not a tax. He just made that determination on his own. Other judges have looked at this differently, and I think that's another grounds for appeal.
She said everything was interconnected here, which brings us to the question of severability. The judge very specifically only ruled on this one part and stayed away from knocking down the whole law or saying that anything that happened here would affect any other part of the law. Was he correct in that?
I believe a decision does not go as far as it should. In our case, we are making this argument very forcefully. In fact, we're challenging, as you said, not only the individual mandate, but the Medicaid expansion and unconstitutional burden it imposes on the states. We feel the entire statute is unconstitutional because, indeed, it's all integrated. But I want to end with one fundamental point. Everything that the government is seeking here, universal coverage, better access, could be done. The problem of this bill is not the goals. The government chose to do it in an unconstitutional way. Quite frankly, I think for reasons of political expediency. We can have a better approach to covering the uninsured, broadening and decreasing participation, and providing better costs in the insurance market. But it cannot be done without violating the Constitution. That's what this bill does.
Mr. Rivkin got the first word, and you get the last word.
The irony here is that if the federal government issued a public plan for every American, as it does with Medicare, it would not be held unconstitutional. This was a more centrist decision. The president chose to use an individual mandate, which conservatives have supported, like Mitt Romney and Stuart Butler. It is well within the purview of the president and the Congress and the federal government to do that, because it is simply ensuring that people who free ride in the system, who don't get health care coverage but get sick, that they take the responsibility for their own health care.
Neera Tanden, David Rivkin, thank you both very much.